Good morning, and thank you for joining us for this all-staff town hall, where we'll share updates about the library's return to on-site operations. This is a very exciting week at the library as we welcome the first public visitors back to the library tomorrow. We're building on a very successful gradual reopening of more reading rooms for our researchers. Before I welcome Dr. Hayden to speak, I will make a few housekeeping notes. My name is April Slayton, and I'm the Director of Communications. I'll be moderating the questions in the later part of our event today. So after all of our speakers, we will have time for questions, and I would ask that you please submit your questions at any time during the town hall using the Q&A feature. We'll answer as many questions as we can during the town hall today, and we'll work to provide answers to any other questions we can't get to in subsequent communications. So with that, Dr. Hayden, I'll turn it over to you to get us started.
Thank you, April, and thank all of you for joining us for this all-staff town hall. It is hard to believe that it's been 16 months since we were all together before the pandemic hit. And I want to personally thank you for your dedication and your hard work, but also for your understanding and your flexibility as we coordinated telework and made sure that the library continued to fulfill its mission. And I'm hoping that we are finally seeing the light at the end of a tunnel. As you know, several of the reading rooms have been open to the public and researchers, and tomorrow, visitors will return to the Jefferson Building. And tomorrow night, our Films on the Lawn series will begin. And already the researchers and the visitors have expressed deep gratitude to the library for really making their return safe and healthy. And so that's why we want to make sure that you also are part of that effort to make sure that everyone is safe and healthy in returning back on site. There's been quite a bit of teamwork with many library divisions and dedicated people. And when you think about all of the effort that has gone in the last 16 months to get us to this point, we all should be grateful that we have worked together so well. Now, over the past 16 months, we have weathered quite a bit, and many of you have had to juggle personal responsibilities. There have been losses. So many things have happened, and I'm just so grateful and proud of all of you for weathering it and knowing that we all appreciate what you've done. So we look forward to a more normal future with some tweaks, and today's town hall will really give you more of a sense of all of the details that we have at this point. And I want to encourage you to ask questions and to really let us know what your concerns are as we move through this. So thank you. And I really look forward to seeing so many of you and hopefully all of you in person soon.
Thank you so much, Dr. Hayden. And with that, I'll turn it over to Ed Jablonski to make some remarks.
Thank you, and good morning to all. At the beginning of June, we began the third and final phase of the restoration of on-site operations. This phase has three parts, with the first focused on the incremental reopening of reading rooms to a limited number of researchers. As the librarian mentioned, the second part will begin tomorrow and will restart visitor activities with a limited number of ticketed visitors in the Jefferson Building. The final part of phase 3 will complete the return to full operations. There's been extensive operational planning, preparations, and monitoring of health conditions prior to restarting activities. A number of library staff, contractors, AOC personnel, and Capitol Police officers have worked in library buildings throughout the pandemic to ensure the working conditions met the enhanced safety and health requirements. Their dedication and expertise is greatly appreciated and ensured the very successful incremental expansion of on-site operations. Roberto Salazar and Sherry Werb coordinated the efforts of many to prepare for the return of researchers and visitors, and they will give you some insight into the cautious and thoughtful approach being utilized. Detailed planning and preparations will continue to be the standard prior to commencing phase 3.3, which will include restoring office operations for teleworkers. Joe Capello will lead a group of senior representatives from across the library in planning the restart of the remaining activities to achieve full operations. The operations committee will also continue to review progress and identify issues and solutions. The return to full operations will not be a return to the past, and it will be guided by the experience gained during the pandemic. Meg Williams will talk about a major initiative supporting future operations. I expect the library will be ready and conditions will support the start of phase 3.3 after Labor Day. This time frame is for planning purposes only. All decisions to increase on-site operations have been and will continue to be based on a review of actual conditions prior to proceeding. And we will not hesitate to alter plans if unexpected conditions occur. Pandemic conditions are continuously monitored and evaluated, and the recommendations of the CDC and the Office of the Attending Physician provide the basis for health requirements that will be in effect. We have often exceeded the recommended precautions from these experts based upon the advice of Dr. Charles and her staff of health professionals. I would now like to introduce Dr. Charles to discuss health conditions and also congratulate her and her staff on the impressive response to the challenges of this pandemic. Dr. Charles.
Thank you, Ed, and good morning, everyone. It's my pleasure to give you an update today on where we are with COVID in terms of the conditions, not just around the nation, but in our DMV area, and then touch upon some other points that are germane to our safe return. So the next slide shows generally how we have done over the past 16 months, but where we are right now. And I just took out some key stats for you to look at. Back in April of this year, we had 32.8 million confirmed cases. And as of the end of June, early July, we have 33.65 million. So one of the key things I wanted to look at was that in January, we were having over 246,000 cases per day. In fact, I think the peak day was January 10th, when we had over 252,000. Since then, we've seen a 95% drop. In April, it was 55,244, and as of the end of June, 11,925. The deaths, as we sadly noted, have gone up to over 600,000, but metrics, except for some notable exceptions, are declining across the country. Next slide, please. So to go locally in the district, the emergency declaration has ended and they have lifted capacity and mask requirements. The rate of transmission is 0.91, and anything below 1 is definitely indicative of declining rate of infection. And we have over 71% people partially or fully vaccinated. And you can see for yourselves the 7-day average of new cases, 12 per day, hospitalizations about 30 per day. And there are a few stats there also for the overall number of cases the district has seen, less than 50,000 as of July 2nd, and just over 1,000 deaths total. Next slide, please. Maryland similarly has declared an end to the statewide emergency and have lifted their mask and capacity requirements. Their rate of transmission 1.2, and the state has over 75% of its population partially or fully vaccinated. And again, you could see the declining numbers for new cases and hospitalizations in the two key counties that are part of our makeup. Montgomery, 11 cases per day, hospitalizations 19, Prince George's 12 per day, hospitalizations 1.7. And again, their total deaths, cases and deaths are below. Next slide. Virginia. Once more, declaration of statewide emergency has ended and requirements lifted, their rate of transmission 1.1. Anything under 3 is considered to be really doing very well. And you can see the new cases, 7-day average, as well as hospitalizations. And we sort of zeroed in a little bit on Culpeper County region, which is not just our area of Culpeper, but actually several other regions that make up that area. Next slide. So what has brought us to this, and why are we confident that we can start our return of more staff to the library? Let's go to the health and safety precautions. Next slide. So again, physical distancing, social distancing. One of the most effective ways, absent the vaccine, that we used to limit the spread of COVID-19. We also limited the number of people on site. There were limits in the capacities. Well, actually, there was no capacity in the reading rooms at that time. The elevator capacities were limited and still are. And coming in for this reopening tomorrow, visitors will have timed entry tickets. You'll hear more about that. The reading room limits are limited. You will hear more about that. We're still maximizing and encouraging telework, and we still have appropriate signage around the library. There are barriers where necessary, if face-to-face contact is unavoidable. And we are recommending mask use for certain categories. And if you're unvaccinated or partially vaccinated, or if you absolutely must work closely, less than 6 feet, more than 15 minutes. The implementation of these measures throughout the pandemic time and now has resulted in us recording 0 cases of COVID-19 transmission within the library. The health services has tracked almost 400 reports of COVID-19-like symptoms in library employees, most of whom were not on site when they were having these symptoms. And we've had reported about a little over 105 positive tests for COVID-19. Again, not all people in the library. This past week, we had no reports, no cases. And that percentage of even testing positive to report is way below the national average. And again, I want to give credit to the staff who have had to be here and who have been coming in since June, because it is because of their high level of personal and professional responsibility in following the recommendations and requirements that we've been able to have this impressive track record. Next slide. So what is required for when you come now and when you come in, when new people come in tomorrow? All employees, contractors, researchers, visitors must do the self-screening prior to entering. Everyone has a copy of this or has access to it online. Since June, we've done over 170,000 screenings and had staff at the entrances verifying as you come in to assure that people have completed their screening and that they're not experiencing any active symptoms or any elevated temperature. In all this time, since June of 2020 until now, we've turned away only 12 people for not meeting our requirements. And of those people, 5 were having symptoms or fever. The remaining were needing to complete their quarantine or testing requirements post-travel. So here at the start of phase 3.2 tomorrow, Thursday, July 8th, we will no longer be doing the at the entrance verification checks when you enter. Those are be discontinued. So we are now having you continue to do your self-assessment and to follow the directions of not coming in if you're experiencing any symptoms, if you're feeling ill. And if you do have yes answers to any of the questions in the screening tool, which we have updated, you report them to the HSD COVID-check-in at loc.gov box. You don't have to report anything else but your yes and answers. Masks that securely cover the nose and mouth and fit snugly against the face are required for all visitors, regardless of vaccination status, and also for unvaccinated badged personnel, including employees and contractors entering library facilities. We continue to urge you to do hand washing, and if soap and water are unavailable, hand sanitizer widely available both within office spaces and in common areas. Sanitizing wipes are available for cleaning down common use items and high touch surfaces. And we have cleaning protocols in place when circumstances indicate the need for that. Next slide. Vaccines. And I've listed them as the ultimate preventive measure. Next slide. Vaccination is undoubtedly the key to controlling the spread of COVID-19. The scientific research and real-world data that we have tracked on a daily basis continue to support the case that vaccination significantly decreases the spread of the virus. And those states that have moderate to high levels of vaccination continue to see declines in their case numbers, their hospitalizations, and their deaths. And hospitalizations and severe cases are almost exclusively in unvaccinated people. And I would just refer you to my initial numbers to underscore that. I said something about metrics continuing to decline with notable exceptions. And the areas of high unvaccinated populations are those notable exceptions. I cannot emphasize more that in order for us to really stop development, everybody asks about variants, and I will get to that, but in order for us to stop the occurrence of variants and get our pandemic under control, we have to stop the transmission of the disease. And vaccination for all who are able to get it are really what will help. Vaccination coupled with all the other precautions that I've underscored. The vaccines are safe and effective are effective against all the current variants that we are having here in this country, the Alpha, the Delta. So there are very few reports of severe reactions to the vaccine, and there are few reports of breakthrough infections. It's not unheard of, but there are few. Fully vaccinated individuals, for the most part, are able to resume many of their pre-pandemic activities safely and in the right circumstances without a mask. Vaccines are widely available in the health departments, pharmacies, doctors' offices, and here on Capitol Hill. And if you're a badged library employee, contractor, you can call the number that we have promulgated through many messages to schedule a vaccine through the office of the attending physician. Next slide, please. Now, we've all heard of the White House goal, 70% of Americans over age 80 wanting to have them receive at least a partial vaccine by July 4th. Did not quite make it. It was, as of July 2nd, 67%. But our area, Washington, D.C., Virginia, and Maryland have all reached that goal and surpassed it. And actually 19 states were able to achieve that goal. And as you can see, more than 70% of adults over 30 and over 26 received their first dose by July 4th. The one area where we're seeing not a lot of people getting vaccines, adults 18 to 25 population. They are not indicating that they will get it, and it's not been a very strong response in that age group. And that is where my concern and that of the public health community lies, because when the rates are low, the Delta variant of the vaccine, the virus rather, is slowing that decline. And when you're not getting vaccinated, we're seeing more cases there. And in fact, in places like Missouri and some other states with a very low vaccination rates, they saw an upswing of their cases in the past week and weekend. So, you know, someone asked yesterday about what we think of the Delta variant. Well, we certainly are monitoring it. It is, as of June 20th, considered a variant of concern by the CDC. And it's considered to be more contagious and maybe also more potent. And so we keep encouraging vaccines. If you're vaccinated, you are protected. If you're not, now is not the time to let your guard down. So next slide. If you only receive 1 dose of a 2-dose vaccine, please complete that. So we've had about 47% of the country fully vaccinated. And we highly recommend that for those with chronic conditions and those who care for people with chronic conditions. And we know from the research that they provide nearly 100% protection against severe illness, hospitalization, and death. But if you don't have it, you can't get protected. If you're not protected and it keeps getting transmitted, the virus keeps changing, because that's what viruses do. They mutate and we get new variants and we continue to have issues. So I continue to urge you to do so. And if you're not fully vaccinated, continue to avoid crowds, keep your distance, wear your mask. Next slide. And for now, that's it for me. And it's my pleasure to introduce the Chief Operating Officer of Library Collections and Services Group, Roberto Salazar. Thank you.
Thank you, Dr. Charles. Good morning, everybody. I hope that each of you is doing well. At the end of March 2020, the Library of Congress, like other public cultural institutions, was forced to close its buildings to researchers and visitors because of the pandemic. By mid-spring, it was apparent that the on-site closure of the library's 20 reading rooms would continue for an uncertain period of time and would require the development of new procedures for staff and the public to return to and work in our buildings. As a major research library, the operating status of the reading rooms was of major concern, not just to the Library of Congress staff, but also to the community of scholars and researchers that depend on that access. As part of many initiatives and working groups created to ensure the continuation of the library's mission during the pandemic and to make preparations for the eventual resumption of public access, a special committee of the Library of Congress senior executives and public service managers was selected to form the library's Reading Rooms Committee. Next slide, please. The Reading Rooms Committee was charged with identifying new guidelines and operational requirements that would ensure the health and safety of library staff and the public once conditions allowed for the reopening of the reading rooms to researchers. The many logistical and staffing changes with an unknown reopening date expanded the scope and planning complexity that were required to move from discussion to implementation. The Reading Rooms Committee maintained extensive and continuous coordination with the library's own Health Services Division, the Office of the General Counsel, the Office of Communications, and the Office of Security and Emergency Preparedness, as well as the Librarian's Office. The Reading Rooms Committee developed a methodical plan for the reading rooms to reopen incrementally in phases and by building. This would allow for services and staffing to be ramped up from the hiatus and also for the new guidelines and procedures to be assessed or modified in practice at the beginning of the reopening, with the opportunity to improve processes as phases progressed. Major changes in service policies from pre-pandemic routines include required appointments in designated time slots for all researchers, significantly restricted occupancy limits that exceed physical distancing requirements, and adherence to new health and safety guidelines relevant to limiting contagious exposure. Next slide, please. We first opened a temporary electronic resources center in the Madison building in a safe and controlled environment on September 28th of last year. And we began reopening reading rooms in the Madison building this past June 1st, with the health and safety of library employees and visitors being our first priority. Since June of 2020, the library has required all staff and visitors to pass through a health screening review upon entry to the buildings. While in reading rooms, all staff and visitors must wear masks and adhere to physical distancing guidelines. Inside the reading rooms, plexi screen barriers are located at service desks, and an expanded cleaning routine has been established. New signage is installed specifically designed to emphasize health and safety policies and encourage designated pathways. Next slide, please. As of now, 12 reading rooms have reopened incrementally under this strategic and methodical plan, ensuring continued health and safety during the reinstatement of on-site operations. Tomorrow, July 8th, the Copyright Public Information Office will reopen. And on July 12th, we will reopen an additional 4 reading rooms. The CRS reading room has been open since the start of phase 2. The Reading Rooms Committee is planning an implementation initiative with a focus towards full reinstatement of reading room operations to include, when conditions permit, increased capacity limits, optional reservations, and expanded hours. Again, only when conditions permit. We are grateful to all the staff working diligently to make all of these reopening phases possible and supporting researchers while also maintaining extensive health precautions. Thank you. Our next presenter is Sherry Werb, Director of the Center for Learning, Literacy, and Engagement.
Thank you, Roberto. I also want to thank the Reading Room Committee for your ongoing insights and learnings from opening the ERC and the reading rooms first, and it helped us follow similar processes moving forward. I also want to take a moment for a shout out to Katie Klenkel, the new Chief of Visitor Engagement, a key partner on this project to reopen the library to public audiences. Next slide, please. So just where we are today, tomorrow, next slide, please. We're going to be opening the library with a soft opening on Thursday, Friday, and Saturday. We're very excited. There are tickets, which is a new feature for this opening. We offer 30 days of ticketing for every Thursday, Friday, and Saturday in July and August between 10 and 4. We're limiting ticketing to 25% of the building capacity based on what we saw in past years. Every 15 minutes, 50 people will be allowed to enter the building. We have sold out the number of passes for this coming weekend, 3,150 tickets. We imagine there will be some attrition, so that will allow us to practice welcoming visitors to the library. Yesterday, we began training, and today we're doing some dress rehearsals, and tomorrow we will open the building. Next slide, please. So what will happen on July 8th? We have minimal opportunities for visitors. People will be able to come into the building, see the Great Hall, visit the first and second floor, the Buell Map area, Gutenberg Bible, main reading room overlook, and the library shop. As we move forward on July 15th, the exhibits will begin to open, and we have presented some pathways for visitors to go through, because we will have minimal staffing interactions in terms of tours, etc. We will also be opening a virtual volunteer service during the weekend of the 15th and beyond. Many of you may have seen this at the Smithsonian Air and Space Museum. Volunteers from home will be able to interact with visitors via Zoom, which will be a very exciting service to offer. And then later, we will begin to open more of the spaces that require some more close contact. Moving, next slide, please. So just a little background about how we got to this moment. Took a village or many villages. Next slide. We started in June of 2020, thinking about this, and established a charter for the PASEC group, Public Access Special Events Committee. And we initially developed an actionable plan in a dream phase of how soon we would be able to open the building. we put together a phased implementation strategy, a staffing plan, and a plan for the types of services that felt safe for visitors to engage with, including socially distant CDC compliant approaches for navigating the building and exhibitions. Starting in October, when we thought we were getting closer to opening, we needed to move into the implementation phase of PASEC. At this point, we started to acquire the necessary physical resources to prepare the building for the restoration of public access. And this would include such things as signage, thinking about radios, a ticketing process for bringing people into the building. We also started to put together some webinars and other opportunities for preparing frontline staff and volunteers for safe return to on-site service positions. And we wanted to make sure that they felt safe in their approach to interacting with visitors. So we provided various webinars and opportunities for asking questions and participating in these kinds of trainings. We also did some customer service and de-escalation strategies in the event people don't want to wear masks or have challenges with the way that we are structuring our interactions. Also, many of us have not interacted with many people in the last year. And so we wanted to make sure that we were renewing our customer service approaches and providing emergency preparedness protocols. We've been coordinating with key stakeholders to ensure that everything we're doing is consistent, particularly working with the Reading Room Committee on making sure that we're having a seamless integration of the public access back to the library and are distinguishing researchers who will have their own passes from those who will come in to have tickets to visit the building. We've been working very closely with the Office of Communications, the architect of the Capitol, integrated support services, library unions and senior leadership, and exhibitions. And next slide, please. You can see from the beginning, when we started the initial PASEC group, we have an enormous alphabet soup of participation in thinking about the strategies for returning to the library. And behind each of these individuals are their teams and colleagues who help make it possible to move this forward. Next slide, please. In our PASEC 2.0 phase, we added more people and integrated new thinking into the process in order to make sure that as we began to open the building, we had all the resources and support from across the institution. Next slide, please. So part of our process has been benchmarking because the Smithsonian has opened prior to our opening, and we've been able to learn from other institutions like the Spy Museum, Planet Word, and other institutions around the country that we visited or others have visited to give us some information about what's working, how signage should look, how to greet visitors, how to make sure that if you don't have a ticket, you're still possibly welcome to come into the building, and how to show sort of a consistent approach to signage so that people will feel comfortable coming into the building and recognize the symbols that they've been seeing in other places. Next slide, please. Other preparations that we've made are integrating new features into the experience. We are now having radios for visitor services staff, visitor engagement staff, to be able to communicate around the building to make sure that there's not crowded conditions and to make sure that people feel safe around the building. As part of the process of creating more services, we now have these self-fill bottles and more hand sanitizing and signage, thanks to the design office for helping us to do this, and the exhibit office for working with us on the signage program. And then we're also going to see some new branded staff apparel in the form of vests, masks, and lanyards. And this will help visitors see staff from a distance and know that they are there to help them. Next slide, please. Finally, we have worked very closely with the communications office and OCIO and others to make sure that we are creating a seamless, understandable experience for the visitors returning to the library. The timed entry passes is very clear. You can go to the website, you can find information on how to get a pass, and we send you emails to let you know that you've received your passes. We have scanners to scan the passes when you come into the building. We have sent out press releases, a very successful operation with a lot of people, almost 1,000 people a day now signing up for tickets to come back to the building. We've updated our web pages to make sure that all the information is up to date and that people understand what services are available at what time. And we've been doing a lot of social media promotion. You should know that starting tomorrow night, we will be having 5 films on the lawn, starting with The Princess Bride from the 2016 National Film Registry. And you can look it up on the website beyond that. So I would just like to thank our visitor engagement staff and library events office and informal learning team who are back on site and ready to greet visitors and to learn from visitors about their needs and expectations, and to be in a position to adapt as the changing policies and procedures appear. So thank you for your attention. And I would like to now introduce my colleague. Next slide, please. Meg Williams, Deputy General Counsel, and Joe Capello, Chief Human Capital Officer.
Thank you, Sherry. Good morning to everybody. I'm pleased to be joined by Deputy General Counsel Meg Williams today to speak with you about a framework for post-pandemic telework. But before we jump into the telework framework, Meg and I thought this would be a good opportunity to tell you what we've been working on for several weeks, which has helped inform the framework that we'll discuss with you today. So let me speak briefly about a few important items. First, I'd like to address restoring full operations. Our team has spoken to quite a few of you to get a better idea of what's on your mind as local conditions allow us to return to the library in phases. I'm going to rely on that information as I convene and chair the newly formed Return to Full Operations Committee, which Ed Jablonski discussed with you earlier in this presentation. It will comprise representatives from across all service units who will participate in assessing the range of activities that the library needs to consider in order to return to full operations. This will include direct service support such as cleaning services and logistics services for business unit operation needs, as well as activities or services such as the fitness center or cafeteria to support employees during the workday. Let me next talk to you about the library's many efforts to maintain a safe workplace. The library closely follows the Safer Federal Workforce Task Force that was established earlier this year and is led by the White House COVID-19 response team. We monitor a variety of topics in order to inform our library workplace policies. For example, we're integrating learning from employee and supervisor experiences and feedback. We're developing, offering, and support flexible work schedules, alternative work schedules, and other personnel policies. And we're developing training and resources to support employees and supervisors in a post-pandemic hybrid work environment. And speaking of hybrid work environment, let's now move and talk about telework. The library's senior leaders are committed to building a flexible and agile workforce, and supervisors and employees will have the ability to leverage telework and flexible work schedules to support mission delivery and work-life balance. And Meg will talk later about future telework agreements and how they'll be based on requirements of a position and the most effective work environment to deliver on the library and the service unit's missions. Now, while I can't give you an exact date, the library does continue to maintain maximum telework flexibilities, likely at least until Labor Day. This does mirror the operating status across the federal government for all telework eligible employees, while maintaining the day-to-day operating status that's required of a public-facing cultural institution. Developing our new telework policy has and continues to be a collaborative process that included input from all service units. And because it's a policy, the Office of General Counsel has been a leading voice in this initiative. And it's fitting that we have Deputy General Counsel Meg Williams here to share the framework elements of the future library telework policy. So with that, let me turn it over to Meg. Meg?
Thank you, Joe. Kelly, can we move on? Our goal now is to learn from our pandemic experience and help that inform the future telework when we all come back to the library and the pandemic is hopefully in the rearview mirror. One thing we've learned is that the fundamentals about telework are still true. Next. Telework is at base a flexibility that's intended to enhance the library's ability to fulfill its mission. And if we do it right, it can provide a good work-life balance and morale boost and give better job satisfaction and productivity for employees. It can help the library with our ability to recruit and retain talent, to accomplish our objectives and to carry on in an emergency. And if we're careful, we can use telework to help us reduce costs and improve our space usage. If we're teleworking more, we can improve the environmental impact of the agency. We can even reduce the traffic and improve the regional quality of life. So telework has many benefits. Our goal is to try to figure out how to strike a new balance with our routine, regular, ongoing telework. We need to be able to be flexible, but still serve the library's mission. We need to regularize and make sure that we have consistency across the library, but still be able to reflect the unique work of our different service units. So we need to look at where we work and when we work. The first thing we're thinking about is having a real hybrid workplace where people are working on-site and remotely. Next. Everyone is going to be expected to work on site between 2 and 4 days a pay period. The service units are going to establish this floor, this on-site floor or minimum in this range based on their mission needs. I would anticipate, for example, that service units that do a lot of face-to-face work, that work heavily with our physical assets, might be at the 4-day pay period end of the range. Service units that are more digital might be at the lower end of the range. But just because we have a range doesn't automatically mean that everybody's going to be able to telework between 6 and 8 days. Some positions will have telework availability that is the service unit minimum. But some positions, as we know, will need to be on site every day. It's most likely that most positions are going to fall somewhere in between being on site every day and the service unit minimum. And the way we're going to figure it out is that service units are going to work with HCD at the directorate level to go methodically through the PDs and to assess what is the appropriate on-site and remote balance for each of the jobs. They're going to look at them based on series, look at similar jobs, perhaps look at work teams, think about everybody who's needed to make a certain operation work. Or if they're individual PDs that have many incumbents, they'll assess what the appropriate balance is for those PDs. So we're going to go through all the PDs this summer and come up with the availability that is position specific for the PDs. Hopefully, again, giving some consistency within a service unit, within a directorate across the library. Once the availability for telework for a position is established, then we'll look to the individual employee's eligibility to get the telework that's available for that position. And there's really no change here. This is going to be assessed by individual supervisors the same way it is assessed now. It'll be based on an individual employee's conduct and their performance and their ability to work independently. As you can imagine, there's some conduct issues that aren't really compatible with telework. If you're having difficulty with performance requirements on site, with the support and supervision on site, it may be that telework is not right. Similarly, it may be that people who are newer to jobs need more time working with their colleagues, working on site, learning the ropes before they eventually grow into the independence that would allow them to have the maximum potential telework that's available for their positions. Next. So with this various on-site and then remote workspace, we're also going to look at the telework hours. Our idea is to expand the telework flex time hours in the morning and the evening, and also expand to allow telework on Saturdays. We need to make sure that we still have, we meet the needs for client service, our public hours, and that we still have opportunities for teamwork and collaboration. We can't all set our schedules so that we don't have any overlap. But there's no expectation that people are working around the clock or that you're available at all times. The idea is that within this larger band, individuals will be able to work with their supervisors to establish regular daily schedules. Next. One important thing is we're going to expand sort of the midday flex time we already have and allow people to work discontinuously, meaning you can work in the morning, you can stop midday, you can work some more, you can stop to pick up your kids, and then you can work some more in the evening to finish up your day. We think this is key to that work-life balance, helping people arrange their days to get their work done, but also make sure that they're getting their lives together as well. We need to, because we're going to be having this wider work band, still need to make sure that we have time to collaborate during this work band. As I said, we're going to have to think through, what does it mean to have core hours? When do we need to be available to our colleagues for meetings and for collaborative work? And when can we focus on our individualized work? We want people to be able to have a stable schedule, both so that they can plan their lives and plan their days, and so that management can plan staffing and make sure people are available. But as now, with reasonable notice, you can still be called in on site, even if it's your telework day, if there's some need for a special briefing or something. At holiday times or when scheduling is an issue, telework schedules can be suspended temporarily to allow units to work out coverage. And if an arrangement is not working, it can be terminated. This is all carrying forward from our current situation. So even though we want to have stable schedules, we can adjust them as needed and on an ad hoc basis. We still want supervisors and employees to know that they can be flexible during any given pay period. If you and your supervisor work it out, you can shift your telework day around. If you're called in on your telework day, you can have a different day that can be your on-site day. So we'll try to be flexible within pay periods. All right, other lessons that we've learned is that we've had some other types of telework that are out there. I've been talking about changes to routine, regular telework. During the pandemic, we had a special kind of telework. We allowed people to do distant telework, which in our definition was people who were working 100% remotely from outside of the local DMV, local DC locality pay area. Because we had an emergency going on during the pandemic, we were allowed to keep paying people at the DC salary rates. After the pandemic, that will no longer be true. So we're going to be shifting our approach to distant telework. It's not going to be available for permanent employees. Instead, it's going to be only for temporary and NTE term positions. And the pay that people will get will reflect their telework location, not their DC work site. As before, we'll still have situational short-term telework if you need to telework for a project that you're working on, or somebody breaks a leg and it would be more convenient to telework. These are short-term situational arrangements, and they're still going to be available. We're always still going to have telework as an ADA accommodation. As you know, this goes through the whole ADA process, where we do an iterative process working with the employee and the supervisor and the health services office to figure out what is the appropriate modification to the employee's job that'll make them able to perform successfully. Telework is one of those accommodations. It'll still be available. It'll still follow the ADA process. So there's no change there. Routine, regular telework is still going to be voluntary. But as before, and in certain emergency situations, we can require people to telework. And now that we're all telework capable, we are going to require people to telework in an emergency or in a continuity of operations sort of situation. We're going to try to establish an automated system to centralize some of the bureaucracy of setting up telework arrangements so that employees can go into an online system and request it, so that it can be approved through their unit, and so that we'll have something that documents the expectations of the telework, the health and safety checklist, all of that kind of paperwork that goes with telework will be centralized into an automated system to make it easier in the 21st century for everybody. What we really want to do now is figure out how to build on our momentum so that we have this ready to go by, say, 1 October, which means people need to be able to be requesting new telework arrangements in September, which means that we have a lot of work to do now in July and August. What management is working on right now is that we're working through assessing the positions, we're developing systems, we'll be updating the LCRs. We've begun preliminary discussions with the libraries unions, and we'll be negotiating with them on that. CREA has been negotiating with CRS management about telework for some time, and that negotiation will be proceeding. It'll be informed by this overarching policy, but it's still proceeding on its own track. If you're a bargaining unit member, I suggest that you share your thoughts with your union, and both you and everybody are encouraged to share your thoughts with your supervisors and with HCD as we move forward. I also want to commit to you that we're going to keep you all apprised of the progress of turning this new framework into a reality. It's going to be an exciting time. It's going to require an ongoing commitment from all of us, supervisors, managers, and employees alike, to make this work. But I think that we can get there from here. I'm excited about it. April, we don't have a lot of time left, but would you like to turn to some questions now?
I would. Thank you, Meg. So the first question I'm going to ask is for Dr. Charles. In phase 3.2, are staff reporting for duty at Fort Meade, Landover, Cabin Branch, and other locations off Capitol Hill campus still required to email HSD prior to entering the building each day with their responses to the daily health screening tool?
Thank you, April. We are only requiring staff to report any yes answers. We do expect staff to continue to answer those questions for themselves and screen themselves as a part of the self-assessment before reporting to work, wherever they're stationed.
Thank you. And do staff need to continue to complete daily contact tracing logs when they're on site?
For now, we have asked staff to maintain the logs if they're not in their usual spaces or if they're doing a lot of moving around, so as to help us should we need to do any of that.
Thank you. Meg, a question on the telework policy. Will this new telework policy begin when phase 3.3 begins, or will the current telework flexibilities continue to be in place during phase 3.3?
Well, we hope to be able to roll it out beginning in September so that people can request new arrangements, which will begin with fiscal year 22. If for some reason we're not ready in time, then people would be returning under their old telework arrangements.
Thank you. And as part of the new telework policy, can you say how sick and annual leave days will count towards on-site or off-site work days in a given pay period?
Oh, there's no linkage between your off days and your on-site and your telework days.
Okay. And would employees be allowed to have a telework on-site work combination in a single day?
That is not our current approach right now. Our plan, as we roll this out, is to have full days on-site and then full days off-site, not splitting them.
Thank you. And would permanent employees be able to telework outside the DMV for a short term, such as 2 weeks, without being considered distant telework?
If you're doing something within a single pay period, then we can make an arrangement. Beyond that, there are OPM regulations that would make that challenging.
Thank you. For those who have PDs that didn't originally include the option to telework, will those positions be considered for telework eligibility?
We're looking at all of the positions, and we're going to be assessing what is the work that needs to be done on site. Is that satisfied by the service unit's minimum, or are there really more days that are necessary for that position to be on site? So we're looking at all the PDs.
That's great. Thank you. Joe, for the group that's doing the return to operations for staff committee, does that include representatives from all of the non-Capitol Hill campus library facilities?
Thanks for the question, April. Absolutely. We have representatives from all areas to include, pardon me, NLS and NAVCC, and we have a kickoff meeting tomorrow for that committee. So the answer is yes.
Great, thank you. And do you happen to know when will junior fellows and interns be able to come back to work on site?
We don't anticipate junior fellows or interns returning back on site during their current terms. We're assessing past the fall timeframe for when interns and the future junior fellows for next year would return.
Thank you. Ed, I have some questions about facilities that you may be able to answer. Is there a plan to reopen more doors to facilitate access to the Adams building?
Currently, there isn't. But that will be looked at as part of the return to full operations, and we will have a phased approach. The Madison C Street entrance will be opening starting tomorrow, so that's the next step in having additional entrances open to the buildings.
That's great, thank you. Can you say if there's an update on when the cafeteria might reopen, and more access to the credit union?
As we put in the staff email recently, which I encourage everybody to continue to keep reading, since we will, be updating status and that the credit union will open for 2 days a week, starting next week, and by appointment only. And there's the details about that in the staff email. As far as the cafeteria goes, that will be part of the planning that will be done for phase 3.3.
Thank you. Can you speak to the current policy on elevator capacity? Can colleagues share an elevator voluntarily?
We are still requiring physical distancing for everyone that's in the building. That's recognize that that's over and above what the requirements are for fully vaccinated individuals, but for now we're keeping that additional precaution in place.
For the hydration stations that Sherry mentioned, are those being installed in other library buildings beyond the Jefferson building?
Yes, we have installations already completed in the Madison, and there's a plan to install. It takes a while and to do these installations, and there's a workload issue, but we're looking at getting one additional one done at least every couple months.
Thank you. Dr. Charles, I have a few more questions here for you. We are getting close to the hour, but is it likely that the COVID-19 vaccinations will be a yearly vaccine like the flu vaccine? And are there plans to offer boosters for those who receive the Johnson & Johnson vaccine and might want the protection of an mRNA vaccine?
All those things are under consideration by the CDC and the ACIP. Currently, there is no booster that is been designated as needing to happen. NIH is looking at combining a mRNA vaccine and say the Johnson & Johnson vaccine, but that is all an investigational process right now. And the idea that it may become an annual vaccine, again, that is strongly being considered, but no final decisions have been made.
Thank you. And does that library have a sense of how many or what percentage of library staff have been fully vaccinated?
Rough estimates are between 50 and 60, but I really don't have any definitive numbers.
That's great.
50 and 60%.
Thank you very much. We have many more questions than we have time for answers for today, but we are keeping track of all the questions that are coming in, and we'll do our best to answer as many of those questions as possible in some of our future communications and frequently asked questions documents. So if you have questions after the Zoom meeting closes, please feel free to send those to staffquestions@loc.gov. And again, we will try to answer as many of those as possible.